In this training, we will be discussing special diets in the Child and Adult Care Food Program. The incidence of allergies and intolerances has increased dramatically in the recent past, and special diet requests are something that most, if not all, child care providers have had experience with. During this training, we will discuss situations where a food or beverage substitute might be needed, the documentation that is required on the food program, substitutions that can be made, and then we'll go over some specific examples to give you a better idea of how to implement the information that we go over. First off, when might a substitute be needed? The case of an allergy or intolerance is a very common reason for a diet substitute request. An allergy is when there is an immune system reaction to a specific protein. An intolerance is when there is difficulty in digesting a particular food or nutrient. Allergies and intolerances can range from severe to mild, and it is important that you as a child care provider be aware of possible life-threatening responses that could occur in children with allergies. Another reason for substitute requests would be a parent preference and/or a religious preference. When discussing this topic, it's important to address the topic of disabilities. This will play an important role as to how you handle special dietary requests. The definition of a disability, according to the Americans with Disabilities Act Amendments Act of 2008, is any person who has a physical or mental impairment which substantially limits one or more major life activities, has a record of such impairment, or is regarded as having such an impairment. The term major life activities includes the category major bodily functions, which encompasses functions of the immune system, normal cell growth, digestive, bowel, bladder, neurological, brain, respiratory, circulatory, cardiovascular, endocrine, and reproductive functions. This is important to know because allergies or intolerances often affect one or more of the major bodily functions. If there is a special dietary request from a child whose need for a substitution is diagnosed as a disability, you must comply with the request. If you think accommodating this request would create an undue hardship on your center, please contact our office. When determining if the substitution request is a result of a disability, it's important to know who made the determination. In order to be valid, the form needs to have been signed by a licensed physician, which is an individual who has the authority to write medical prescriptions. In Utah, this includes medical doctors, physician's assistants, osteopathic physicians, advanced practice registered nurses, and naturopathic physicians. In some situations, the medical authority might have not stated that the child has a disability, but did describe the symptoms. If the symptoms described meet the definition of a disability, meaning that they substantially limit a major life activity, you could treat it as if the medical authority had diagnosed a disability and serve whatever was instructed to be served. If the child's condition is not considered a disability, the center may honor the request but is not required to. In the case of a milk substitution request that is not considered a disability, the substitution given in place of cow's milk must be nutritionally equivalent to cow's milk. In this slide, we'll discuss nutritionally equivalent options to cow's milk. Lactose-free milk is an option that might work for participants who have lactose intolerance. Lactose-free milk is cow's milk that has had the sugar lactose broken down so that it's easier for those with lactose intolerance to digest. Lactose-free milk is cow's milk, so there is no documentation needed in order to serve this to a participant. At this point in time, the only non-cow's milk beverages that meet the requirements to be considered nutritionally equivalent to cow's milk are soy-based beverages. Not all soy milks available are nutritionally equivalent, so you need to be diligent in checking labels. Keep in mind that even if the product is nutritionally equivalent, you would still need to have a note on hand from either the parent or medical authority. This chart is your guide to know if a non-cow's milk beverage is considered nutritionally equivalent to cow's milk. You can find this chart on the USOE website or you can contact your specialist and they can email you a copy. In order to determine if the beverage in question is nutritionally equivalent, you'll need to look at the nutrition label. If all of the nutrients in the product meet or exceed those in the blue columns, it is considered nutritionally equivalent. Keep in mind that you don't need to fill out all 3 of the white columns. We'll go through a quick example so you can see how this can be an easy tool to use. A little tip that you'll want to keep in mind is that the protein amount is usually the limiting factor. If you check the protein and it is adequate, keep looking. If it's not, then just put that one back on the shelf. So let's check protein first off. You can see that the amount of protein is 8 grams per 1 cup serving size. That meets the requirement. So let's keep on looking. Let's go back up to calcium. You can see on the label that the calcium amount is listed as 30% of the daily value. So we will fill in the 3rd white column. Next, we'll move on to vitamin A, D, magnesium, and phosphorus. These nutrients are all listed as percent of daily value, so we'll use the 3rd column again. Potassium has both the amount in milligrams listed as well as the percent daily value. For this example, we'll fill in the 1st column with 360 milligrams. Riboflavin and vitamin B12 are both listed as percent of daily value, so we'll fill out the 3rd column again. As you can see, all of the nutrients meet or exceed the values in the blue columns, so this would be a nutritionally equivalent option that you could serve. You don't need to fill out this form for each soy milk that you serve. This can act simply as a guide. If you're having trouble finding a nutritionally equivalent milk option, please let the state office know and we can help you. Another thing to keep in mind is that the manufacturers do change their products, so even if you find a soy milk that works, make sure to continue checking the nutrition facts label to ensure that it continues to meet the requirements every time you serve it. Now let's move on to the documentation that is needed. You are welcome to use our form, which we'll go over, but you don't have to, as long as we have information that states the child's disability and an explanation of why the disability restricts the child's diet, the major life activity affected by the disability, the food or foods to be omitted from the child's diet, and the appropriate substitutions. This is a state form that you are welcome to use at your center. This form can be found on our website at www.schools.utah.gov/CNP. We will go over each of the sections and describe what is needed. At the top of the form, there is basic information to fill out, such as the name of the child and parent and telephone number. Directly under that is where the individual will fill out what to not serve and what to serve instead. These boxes must be filled out. Underneath, there is a spot to put the diagnosis. Not all children will have a diagnosis, so it only needs to be filled out if it's applicable. Directly below the diagnosis box is the symptoms and severity box. As you can see, the first option is not applicable, lifestyle or religious preference. An example where this box would be marked is if the family was vegetarian or vegan and requesting substitutions for animal products. Underneath that option, there are a variety of common symptoms related to food allergies or intolerances, with the option of writing in different symptoms as needed. Have the medical authority or parent filling it out check as many of the symptoms as apply, and if they check other, encourage them to write in the specifics. The severity of symptoms can be helpful in determining if the issue could be classified as a disability. Have the individual filling out the form be as detailed as they can. The general comments box is for any additional details that they want to provide. Every case is different, and the more information that is provided, the easier it is on you. The next box that we will talk about must be completed by a licensed physician. In this box, a licensed physician can mark whether the child's need for a substitution is related to a disability or not related to a disability. As we discussed previously, if it is marked as a disability, or if the licensed physician described the symptoms in such a way that it can be classified as a disability, you as a center are required to accommodate the request. If it's not a disability, you have the choice as a center whether to accommodate the request or not. If it is a medical authority filling out the form, they need to sign it and write their title. The medical authority's telephone number will be good in case you need to contact them. Make sure that the date is filled out and that you have a parent or guardian sign. The back of the form has definitions and information, as well as a place for you as a center to document how you're handling the request. As we already discussed, a licensed physician is defined as an individual who has the authority to write a medical prescription, and the details are specified here. The next table is helpful information for you to know who can fill out the form in different situations. If the substitution is due to a disability, then it must be completed by a licensed physician. If the substitution is not due to a disability, there are a few more options as to who can fill out the form. A licensed physician can fill out the form, as well as a registered nurse or registered dietitian. A parent or guardian can also fill out the form, but remember in this case that the meal must still meet the meal pattern in order to be claimed. Next, we have the definition of a disability. This can be helpful for the licensed physician because they might have a different understanding of what a disability is. As we discussed before, you can define a disability as a physical or mental impairment which substantially limits one or more major life activities, with the more specific definitions detailed right below that. Beneath the definitions, there is also another reminder of what you need to do as far as accommodating the request in different situations. Underneath this box is the space for you to document how you're accommodating this request. If the substitution request is marked as a disability, or you're treating it as a disability based on the symptoms described meeting the definition of a disability, you would check that first box and you would be required to accommodate the request. The next option is that it's not a disability. In this case, you have the option to accommodate the request or not accommodate the request. It is helpful for the state agency on reviews and for you as a center to have this documented. Check whichever box is applicable and then date the form. This is a food program document, so make sure to keep it for at least 3 years plus the current year, longer if needed. We realize that special diets can be very difficult to deal with, and each case is so unique. We'll go through a few examples, but keep in mind that we are glad to help you with specific cases that might be different from these examples. In this first example, Johnny has an allergy to cow's milk. Johnny's parents brought in a form from their pediatrician stating that the allergy can be classified as a disability and that he should be served rice milk instead of cow's milk. What would you do in this situation? You would follow the doctor's instructions and serve rice milk. You would need to keep this documentation on hand, and we will ask to see it during a review. In this example, Maria's mom states that Maria has lactose intolerance and does better when served lactose-free milk. Maria's mom doesn't have any paperwork from the doctor. What do you do in this case? In this case, as in all cases with lactose-free milk, you are able to serve the lactose-free milk without any documentation. This example is a little bit more complicated. In this situation, Sally's dad wants her to be served almond milk because she has stomach problems when she drinks cow's milk. He brought in a form from the doctor. It doesn't specify that she has a disability, but does include a description of her symptoms, which are nausea, vomiting, and diarrhea, and they're marked as severe. It states that she should be served almond milk in the place of cow's milk. What do you do in this situation? Although the doctor didn't specify that Sally has a disability, the symptoms described do meet the definition of a disability. Remember that a disability can be defined as a physical impairment that affects a major life activity. And don't forget that major bodily functions, such as the digestive system, are included in major life activities. In this case, you would be required to follow the special diet request because it meets the definition of a disability. In this situation, Xander's parents bring in a note from the doctor stating that Xander shouldn't have cow's milk, but should have coconut milk instead. The form specifies that Xander does not have a disability, and the only symptom listed is nausea. What do you do in this case? You have a few options. One option would be to see if you can get more details from the doctor. If the nausea substantially limits a major life activity, you could treat it as a disability and serve the coconut milk as instructed. Another option would be to check with the doctor to see if Xander would be okay with a nutritionally equivalent milk. If he is, then you could serve that milk. Just remember to get a form that specifies that soy milk should be served. That form could be signed by the parent in this case. Another option, since this case is not a disability, is the choice to not honor the request. Keep in mind that if you choose to not honor the request and you allow the parent to provide the coconut milk, you would be unable to claim the meal if a creditable milk is not served. So far, all of our examples have been situations involving milk substitutions. At this time, we do need to discuss special food requests that don't involve milk. In these cases, the action that you would take depends on who signed the form. If the documentation is signed by the parent, the substitution must meet the meal pattern, and the alternate menu options must be made available to everyone. If the documentation is signed by a recognized medical authority, which includes registered nurses and dietitians, you would follow the medical authority's orders. These actions would be taken whether or not it is determined that the child has a disability. This is a flowchart that can be helpful when trying to determine what to do in different situations. A copy of this flowchart can be found on our website, or you can contact our office and we can send a copy of it to you. To conclude, we hope that you will rely on this training to understand the basics of special diet requests. As mentioned before, we realize that there are so many different possibilities that can occur and that parents are understandably concerned about their children's dietary sensitivities. Please contact the state office if you have a situation that you're unsure of. We are glad to help.